So my name is David Sheppard, and I am a clinical neuropsychologist in the Department of Rehabilitation Medicine at the University of Washington. So it depends on the person, but in general, after both cancer diagnosis and treatment, some of the more common areas that can be affected are first memory, and that includes both retrieving memories, but also learning new information that can be disrupted. Another area that's commonly affected in cancer and treatment is attention. So attention and concentration that can include things like maintaining attention over time, so sustaining attention, or trying to focus during distractions, as well as maybe dividing out our attention. Another area that can be affected is our speed of processing, or how quickly our brain is thinking. That's something that can also be important for various other cognitive functions. So if that's affected and we're not thinking quite as quickly as we used to, or if survivors are noticing that, that can really be impactful both for other cognitive functions and also day-to-day activities. And then the last area that's really common is something called executive functions, and that is really the more complex behaviors that our brain helps us do, things like planning or organization, multitasking, as well as problem solving. And that's one that can also be affected in both cancer and various treatments that are for cancer. I think one of the primary things that survivors can do after treatment and adjusting as far as cognition is really to give their brain as much support and structure as it can have. Before cancer and cancer treatment, there's maybe some things that could be done that have changed, and there may need to be more use and reliance on strategies like writing notes or using a planner that wasn't needed prior. And so the primary suggestion is to give the brain as much support and strategies that it can use to help minimize the effects of any changes on day-to-day functioning, including things like spending time with loved ones, or carrying out finances, or as well as things like medication management, those things that are important for our health and our well-being. So it's important to give our brain as many strategies as we can to help support it. One of the main things that I'll talk about with people who have questions about ways to keep their brain healthy is to just think of their brain health as their heart health. So we know that the brain has so many connections with the body, including the heart, that if we do things like having a regular physical activity regimen, one that helps maintain our either aerobic exercise or moderate levels of exercise, that can help maintain brain health for the long term. The other thing to consider is our diet. So things like the Mediterranean diet, healthy fruits, vegetables, and healthy grains, whole grains, and minimizing trans fats and saturated fats can be helpful for maintaining brain health long term. One thing about cognitive functioning that's really important, and I like to empower patients and their families and care partners to consider, is that some of the changes that can occur after cancer and treatment can be difficult to describe or to measure even. And sometimes it takes being somewhat persistent and also being your own advocate to describe them to your care team, to your family, to your loved ones, as a way to seek help and to be your own advocate. Cognitive changes have such a big impact on our day-to-day functioning, the things that are important to us and our quality of life. And so the more that we can find ways to support survivors and their families and care partners, the better. And so I encourage all survivors and their loved ones to really be their own advocate and to reach out for help, because we're here to help and can do things about cognitive changes after cancer and treatment.